In today's episode of the podcast, we're talking about why you're experiencing low back pain when you lie flat on your back. When we think about back pain or injuries to the lower back, we commonly see that load-bearing positions, increasing the load, that could be standing, walking, could be running, could be sitting down, slouching with worse posture, or even carrying things, tends to increase the strain on our lower back and increase the pain that we experience. And many of you who are watching this with lower back pain will avoid those sorts of activities because it puts that compression through the spine and aggravates the underlying injury. But for most of those people, when they lie down, they experience a respite. They experience relief from that pain because the compressive loading is taken off and the back gets a chance to recover, chance for a breather. But for some, when they lie down, particularly flat on their back, they experience maybe an exacerbation of that throbbing pain in the lower back, or they experience sharp and shooting pain going down into the leg, classically symptoms of sciatica. In today's episode, we're going to talk about why this is happening, what the two most common causes of it are, so you can better understand why it's happening. And then at the end, as always, we're going to go through some strategies, some simple strategies that are really going to help mitigate these issues. And then obviously what you need to be doing in order to deal with the underlying issue. Because I think in a lot of cases, some people will only experience back pain when they lie flat on their back. They don't experience back pain during the day. And this is kind of that early warning signs. We'll talk about that too towards the end. So let's start out by understanding that when you think of lower back injuries, we have to understand that an instability has occurred. Whether it's a knee injury, a shoulder injury, whether it's a back injury or any other injury, it is the structures that maintain the integrity of a joint that become injured. And if we use an example of a doorway, if the hinges, the screws that are holding the hinges in place become loose, become displaced, become injured or dysfunctional, then the door doesn't move quite right. It means that it rubs a little bit on the frame of the door, it jars a little bit, it wears out those hinges because they're now not moving in the appropriate way, because the integrity, the structures that maintain the integrity of that functioning unit, the doorway, have become compromised. And whether it's the medial collateral ligament in your knee that's affecting the stability on that inside part, or whether it's the posterior part of a disc at L5S1, whenever we have these injuries to areas of our body, the stability of those joints becomes questionable. And then if we have other factors at play here, as we'll explore, particularly in the second case, we're going to start to strain those structures that are injured further, exacerbating the problem, creating a buildup of inflammation, and creating the symptoms that then, maybe it's the sharp pain, as I mentioned, or maybe it's that dull ache or throbbing that's occurring. So that's important to have in mind, that we've got an injury there, and there is a degree of instability which is being exploited by the mechanics of lying down. If we take the first one, and today's episode, sorry for those of you that are listening only, I'm going to use the spine because I think it's just really, really helpful. This first example, or the first case of this, is going to be when your lower back is flattening out as you lie down. So this is the first cause. When you lie down, the lumbar spine flattens out and that strains the tissues that are injured. But before we get to the position of lying down, we think about how you lay down. And this can, for some of you, adjusting this particular parameter will immediately eliminate the pain that you experience when you lie flat on your back. And that is that so many people will get into a seated position and then slowly lower themselves down like so, doing essentially what is a reverse sit-up. As you go through that process, you completely flatten out the lumbar lordosis, in an extreme manner. You're often clamoring around for some sort of support as you go down, and that compresses through that lower back disc. It stretches out the ligaments on the back part of the disc, which are going to be injured, and the back part of the spine, and really exploits the weakness that is there. Now, under ordinary circumstances, without any injury, as you go to lie back down, all of the joints will equally unload as you go through that process of lying down with arguably maybe not the best form. But it's not the end of the world if you don't have an injury there. But when you do, the load, the strain, the movement is focused to the injured segment. Why? Because it's more unstable compared to everything else. So all the other joints in the spine and in the hips, etc., are all happy to deal with this increase in force. But that injured segment is being exacerbated. And I thought it's a good, this one is a little bit different to the second cause, in so much that often the pain that we're going to get when it's as a result of the flattening out of the lumbar spine is more likely to be a bit more of an ache that can build up to a severe throbbing and a severe sort of pressure in the area. But quite often, this is just because we are adding load, and it's very similar to that ankle example, because let's face it, when you flatten out the lumbar spine, unlike the second example, we actually make these holes in the back of the spine larger. And if we just use an example higher up, as we forward bend, you can see the holes where the little nerves come out on the front here, they enlarge, which is a feature that is unique to forward bending. Just like when you bend backwards, they get smaller, but they get larger than they otherwise would. And a good example here of why the pain can sometimes come on in a little bit sort of a lower, at a lower intensity, if you will, is that if we've all been out there, we sprained our ankle at some point or sprained a wrist or something like that. Normally it's the ankle for this particular example anyway. And we look down our ankle, oh, that hurt. We hobble around a little bit, we walk home, we get back, sit down, look down, and it's okay. It's a little bit sore, but it's fine. Maybe it's not even that sore after the original insult. And we sat down for 10, 15, 20 minutes and we looked down at our ankle and all of a sudden it's the size of a balloon. Why? Because we had that little injury when we sprained it, when we went over on the ankle. It was minor, but an inflammatory process has started to take place. And when you were moving around, moving the ankle, the calf pump mechanisms, etc., were helping prevent excess inflammation building up, just the movement, the low-grade movement. But as soon as you sit down in that ankle example, it starts to swell. And it's the same thing for the lower back. So if you've gone and slowly lowered yourself with that reverse sit-up technique that I mentioned a moment ago, you've compressed and aggravated the joint. Maybe it's not so painful immediately at the moment that you're lying down. But then after a few minutes, maybe a little bit longer than that, the pressure starts to build in that lower back because inflammation is building up. And unlike the ankle, it can't swell in the lower back. In the lower back, we have these confined spaces where all these little nerves come out and the pressure is building in those bony holes, and then you get the pain and you have to do something like bend your knees up. You have to do a pelvic tuck, which is problematic. That's just making the problem worse. But that is fundamentally what is happening before you even got to the lying down position. So if we can lie down in a more sensible manner, getting onto our side, slowly lowering ourselves down, the way in which we sort of teach on some of the other videos specific to that topic, of lying down. There's a particular one I'm thinking of that's on the YouTube channel that you can check out and on the website. If we do that in a smarter way, then we decrease the excess strain that's going through that particular segment injured in the lower back as we go to lie down. And maybe that in itself, that cessation of aggravation in the process of lying down, will mean that we can lie down without pain. So the second reason, and more specifically to lying down flat on your back, is for some of you, it is going to lead to a slow elimination of the lordosis. So you lie down with a nice neutral spine and then steadily it kind of flattens out like so. And this I would use a nice example of, it's sort of a gentle strain flattening out the lumbar spine. We have to remember that so many cases of lower back pain originate in a compression and a forward bending. It was bending down to put your socks on. It was some other movement. And if we think about those injured tissues in the lower back like a frayed rope, they're frayed. And if we gently pull on that frayed rope, it's trying to knit itself back together again. And you can see this in a surface wound. You can see the tissues, the soft tissues, actually contract together to pull each side of the wound back together again. But if as you lie down and your back flattens out, it pulls on those ligaments, it pulls on those tissues that are trying to heal. And that creates this sort of low-grade aggravation. It's not as severe as I said, the second example, but it can steadily aggravate that lower back. So you're lying there flat on your back, and maybe you're okay to start with, but that flattening pressure that's happening through this lumbar spine, that posterior pelvic tuck, that flattening of the lower back, focusing the stretch to the L5-S1 region and the L4-5 region, eliminating that curve, provoking any disc injuries that might be there, stretching out the ligaments, starts to become problematic, and it steadily builds up an inflammatory reaction in a sort of a more gentle manner. So you often feel that it's a bit uncomfortable, then it's starting to ache, then it's starting to throb, and then it starts to become really uncomfortable and you've got to move. So that's the one scenario. Hopefully that makes sense. And as always with these episodes of the podcast, if there are any questions, post them down below. Now let's get on to the second one. And there's a little bit more to talk about here, a couple more nuanced bits of information. And this is where, as we lie down, our back is pulled into an arching position. So we exacerbate that curve. The primary issue here is going to be one of a hyperlordosis taking place. And we'll talk about a few specific things and why this is happening. When our spine is in a neutral position, as I mentioned a moment ago, the holes have a neutral size to them. And these holes are important because that's where the nerves come out of. A lot of cases of back pain, it's that inflammation building up, thinking back to the example of the ankle a moment ago, inside this confined space that puts pressure on the nerve, pinches the nerve, and we get the pain, be it in the lower back, be it down the leg. When we forward bend, we make the spaces larger at a cost. The cost is that we stretch all of these structures, which quite often are the structures that are injured, therefore disrupting the healing process, therefore making our back pain worse. In a more steady way, we don't often immediately feel the pain because there's a relief from the pressure decreasing in the space because we've made the hole larger. So that's kind of one of those ones where it feels nice at the time, very much like knee hugs, child's pose, and we've done specific podcasts on those episodes to explain in more detail why this is a bad thing. But just for the sake of today's episode, assume that I'm telling the truth and that it is a bad thing as we're going forwards if we have a lower back injury here. But when we bend backwards, we immediately change the space of that hole to make it a lot smaller. And if you can look right down the bottom here, you can see that that hole size really does change, pinches around that nerve. Now, if that's happening, assuming you've got something like, a healthy lumbar spine, there's not really any major disc bulges or anything like that, even if there's a minor strain in there, as your lower back, as you lie down, as it's pulled into extension and that hole gets smaller, the inflammation that's in there all of a sudden gets squashed into a smaller space. And a great example here is to fill up a cup all the way and drop something in it to decrease the available space, and the cup will overflow. Well, if it can't overflow, the pressure inside the cup is going to increase. And if there's a nerve going through there, it pinches that nerve, squashes that nerve. And this is where, as you go to lie down onto your back, as your pelvis drops into what's called an anterior pelvic tilt, gets pulled forwards and your lumbar spine arches and those holes get smaller, you immediately get the sharp pain. Often sharp because it's irritating the nerves. It might also be irritating the facet joints because they come together as you move into that arched position as well. But essentially both of those are going to give that sharp pain. Often this category is more likely to give, so the arching when you're lying down flat is more likely to give you that pain going down the length of the leg, or the classic sciatic symptoms, because we are really targeting commonly that L5-S1 and then to a lesser degree the L4-5 space where the holes are getting a lot smaller. Now, if we think we've got some degenerative disc disease, so the discs are smaller, that space, this space here, is even smaller to start with. So this effect is going to be even more pronounced. If we've got a disc bulge, specifically, you can see this little red one, you can already see on the example of the spine that the space is already smaller than it should be. If we've got something like a spondylolisthesis, again, that changes the structure of the hole where the nerves comes out of, makes it a bit disjointed. That's going to be even more pronounced when we lie down. So if we have the problem of our back being pulled into extension when we lie flat on our back, that's going to be more pronounced. It's going to be more severe in terms of the reaction when you lie on your back with these conditions. Now, what are the causes of this? The main causes are going to be, or why the back is being pulled into extension, is really going to be the fact that we sit down so much all day, our hip flexors become tight. And what the hip flexors do is the hip flexors pull the thigh bone towards the head. But they also allow, when they fully elongate, they allow the hip to move into a position of extension. If they're tight, as the hip moves flat, so to lie flat or even stand straight, it pulls our lumbar spine up into that extended position because they're just too tight, because we're sat down all day and we're not stretching and doing appropriate activities. By the way, not just stretching, but we're actually doing some strengthening work to build strength and integrity through the whole body, through the whole system. We've mentioned many, many times now. Average adult, working age adult, around about 9.5 hours a day sitting down, and they're not doing the work to combat that through practices of exercise and resistance training, etc. And that's a real problem. That's how this creeps in. So as you go to lie down, your hip bone, or your thigh bone, flattens out towards the ground, and that pulls your spine into extension. And that's where the problem arises. Now, you might be thinking, oh, we'll just stretch out the hips. That's going to be one factor, but it's not the only factor. We need to build strength, integrity, etc. Now, there's one final little quirk, and this is born out, or the knowledge of this quirk is born out of experiencing many, many thousands of x-rays of people with lower back issues, lower back injuries. And that is, you'll notice on the spine, and this particularly aggravates the arching component of getting pain when you lie flat on your back. You'll notice how the lumbar spine has nice smooth curves. So we go from the sacrum, which is a C shape, goes into the lumbar spine and up, and carries on this sort of backwards and forwards motion through the entirety of the spine. But they're all smooth transitions. For some, unfortunately, and this is nearly always down to a trauma, because it's very difficult to actually move like this in a natural environment or naturally, they have a hinge point at the lumbosacral junction. So this last joint between the L5 and the S1, so the last green and the orange, forms a hinge. So instead of having a nice smooth curve, it's kind of like a hinge point. And these people, if they arch backwards, if they do something like the cobra, immediately it hones straight in on that area. Why? Because the joint is kind of stuck in an extended position and therefore stuck with the hole smaller, the holes where these nerves come out of, smaller. And therefore any backward movement is going to exacerbate that even more. So they're starting in a worse position. And then as soon as those hip flexors pull even a little bit, it creates a real problem. So that's one sort of peculiar example. Often, as I said, there's some sort of trauma in the background that's preceded or led to the back pain, and they're kind of stuck in this peculiar position, which makes this even worse. But the bottom line with this is what are we going to do? And often when we talk about these sorts of issues of forward bending, of backward bending, and we bring up the towel. And the towel exercise is one of the best exercises you can do at home, anyone can do for your lower back health. And it's going to help you when you lie flat on your back, because the common answer to both of these scenarios is, oh, well, just put your knees up and it'll feel better. And for many, that does work, but it works at a cost. And what happens is when you put those knees up, your pelvis flops back into a posterior pelvic tuck position that enlarges the hole more. It means you can stay there. Inflammation builds up without you knowing about it while the hole is abnormally enlarged. So we've flattened our lower back loads now, and you can see those holes where the nerves are coming out of really enlarged. They fill up with inflammation. Then you go and try and stand up and you realize you can't stand up straight. Why? Because even coming back to a neutral position makes those holes smaller, obviously, and that is now filled with excess inflammation, and that increases the pressure. You get the shooting pain and it hurts. So you get stuck in this vicious cycle. People, when we talk about the towel exercise, think, oh, well, there's that extension. One important thing to understand is if we're standing up and I say, okay, do a flexion movement. A flexion movement is a forward bend. And if we're standing up straight, an extension movement is a backward bend, because we start from straight. The lumbar spine does not start from straight. The lumbar spine, neutral, is a backward bending curve. That is the starting position. So a flexed position for the lumbar spine is a less backward bending curve, or all the way to a forward bending curve, which is actually much more rare than one would think, or much more difficult to get to than one might think, or much further through the range of motion before you actually get into a straight lumbar spine. And an extension position would be something that has more curve to the back. So we increase the extension. When we think of the towel exercise, it is not doing extension. The towel is supporting the neutral natural curve. And by doing that, it does a number of things. Number one, and most importantly, it creates a slight elongation of the spine. So it takes pressure off the discs, it takes pressure off the facet joints, it takes pressure off the load-bearing structures in the spine. But number two, particularly important in these sorts of cases, because it is the instability that is allowing that spine to move at the one particular segment that's injured when you lie flat on your back. The towel supports that natural position. So instability is much more difficult it's much more difficult for that instability to be exploited. Now, granted, you've got to get on and off the towel correctly. If you twist your back, you're going to hurt yourself when you get off, just like sitting down or lying down into that position, doing the reverse setup that we mentioned at the start of the episode. So you've got to use it properly, get on and get off properly. But the towel is there to support the spine, support the instability, and support a normal lying down position in the lower back, so that it can kind of rest and set. But it also takes pressure off the discs, it takes pressure off the ligaments, it takes pressure off the muscles. The muscle tightness is so often there with lower back issues. And it really is a great exercise that you can do every single day, multiple times a day, especially if you're in the throes of quite a significant amount of lower back pain or sciatica, to just start to ease the pressure on that lower back. And if you do this in conjunction with some of the other things that we'll talk about in a moment, then it's really going to help you as a means of being able to lie down, take pressure off, which is so important when we have an injury to a load-bearing structure, to be able to take pressure off periodically through the day. That helps with the healing process. But know that if you are one of those, as I mentioned at the very outset of this episode of the podcast, if you are one of those that only get back pain when you lie down, and you're not actually maybe suffering in pain right now while you're watching this, but it's something that you get every time you lie down, know that that is often the early warning sign. Having seen so many people over the years, back pain is very rarely, like the example of the hinge point, the result of a significant trauma that kicked it all off. Most of the time, it's crept up. And when you explore, maybe there was a trauma that happened or an incident that did happen, but often you then discover, well, actually, there had been a weakening process for many years. It's been aching actually for the last 10 years. And it was only in the last 2 years that I did that thing that one time, and then it really started to get worse. But it's been building for a long period of time. And if you're experiencing this, take the steps now to start to build strength. And really, that is what it is about. We want to be doing some comprehensive strength-based work, learning with proper technique, starting off weight bearing. So learning to actually engage and control the core, because essentially when you lie down, it's the fact that this spine is just being pulled all over the shop and you're not able to hold it steady. Because if it doesn't move, it can't move into a position where it gets strained. And that's really important. If, for example, you have your ankle that's sprained, your knee that's sprained, if it is still, it doesn't hurt. But if you twist it, if you move the actual joint, it will hurt. The problem is you can see and control your knee, you can see and control your wrist and stop it from moving. You can't do that with the joints of the lumbar spine, because you can't say, do you know what, my L5S1 is injured, it's unstable, I'm not going to move it and I'm going to brace it. You can't do that. Physiologically, you just don't have the control. It's just going to move if it needs to move, at the whim of the whole spinal unit. Imagine the amount of brain power it's going to require to move each one of these individually. We just can't functionally do that. So therefore we can't protect it. But what we can do is start to rebuild control for the unit itself and brace the lumbar spine correctly, doing that off weight bearing. We talk about the core engagement exercise, the psoas engagement exercise. We talk about the dead bugs modified to help you learn how to do this off weight bearing in a safe environment, or something like the marching bridges. And we talk about these extensively in the program. And then once you've got that control off weight bearing and you're able to lie there on your back with the spine not needing any support and actually hold that position without getting pain, we can then look to consider movements like the squat, the hip hinge, real life movements that you will not get away with not doing. A nice example that I touched on in the episode of in the article here is that when often as we get older, in particular, we hear this question, oh, well, I'm in my 60s, I can't really do some of that, or I'm in my 70s, or I'm in my 80s. We hear it from lots of different ages, saying, I'm too old, I can't do that particular movement. But these movements, the squat, the hip hinge, the lunge, etc., they are movements essential to life. You are doing them every single day anyway. And we see at certain stages in life, when we cannot do these movements, our freedom, our independence is heavily hampered. We see this at the start of life, when we're a child, or rather an infant, a baby, we can't walk, we can't squat, we can't do any of those movements. We are 100% dependent on others to allow us to live our life. And we see that, unfortunately, at the other end of life, when people lose the ability to do these things. But many people will lose the ability to do these things at different times. But most of the time, we find that those that do not resolve to work on those movements at any age will find that they lose the ability to do those movements much, much sooner than others. So these movements, the squat, the hip hinge, the lunge, without load bearing to start with, after we've learned how to control our core, are suitable to every single one of you. If you go up a step, if you get off a toilet seat, you can do those. If you brush your teeth, you can start learning now, today, to do those movements more effectively. It will help your back health no end for the long term. And then once you've learned to do them, you can then start adding resistance, adding load to rebuild the strength and integrity of not only the muscles that support this area, the tendons, the ligaments, etc., but also the deeper structures of the spine that support that load and bear that load. And steadily over time, you can increase that load to offset some of maybe the inherent diagnosis that you have, maybe the degenerative disc disease that's there, maybe the arthritis, maybe the spondylolisthesis, maybe the other conditions that are down there in the lower back that are maybe, diagnoses that we can't perhaps change because of maybe there's some degeneration there. We can offset that by increasing the strength of the column and increasing the strength and durability of the supporting structure. So hopefully that makes sense. I won't do a whole nother episode on that particular topic because we've already covered that and we've got plenty of stuff on the website, on other episodes of the podcast and the program to help you do what is necessary to build strength and rehabilitate your lower back effectively. But I hope this episode has been helpful in the accompanying article with more detail on helping you understand precisely why you're getting pain in a movement that, if you've got a bad lower back, it should actually, or lying down should actually be a relieving process. Hopefully now you understand why it's not for you and what you can do to start to make improvement in that. If you've got any questions, as always, please do post those in the comments below. I hope you did find this one really helpful. And as always, if you did find it helpful, give it a thumbs up, consider subscribing to the channel, and we'll see you in the next episode of the Back in Shape podcast. Thanks for watching.